Welcome to Healthy Living Simplified, where we break down health topics into easy to understand tips.
Join me as I dive into the topic of discussion.
Pelvic health, vesicovaginal
Fistula VVF, commonly known as urinary incontinence. See if I can uncover the hidden risks that could be affecting you.
When it comes to our overall well-being, there's one crucial aspect that's often overlooked: our pelvic health. It's an area that's deeply connected to our quality of life. Yet many people remain unaware of the potential risks involved.
Incontinence, pelvic pain,
And sexual dysfunction are just a few of the common issues related to pelvic health.
These problems can be frustrating, embarrassing, and even debilitating, but they often go unaddressed.
Because people are too ashamed or uncomfortable to talk about them. Many of us struggle in silence, feeling like we're alone in our struggles.
But the truth is, pelvic health issues are more common than you might think. For example, did you know that over 50% of women
Experience incontinence at some point in their lives, or that pelvic pain affects nearly 20% of women and 10% of men? These statistics are staggering, and it's time we start talking about them. The thing is, pelvic health issues can be a taboo topic.
even among friends and family?
We might feel like we're the only ones dealing with these problems.
But in reality, millions of people are struggling just like us.
By staying silent, we're allowing these issues to persist, untreated and unresolved. It's time to break the silence and start a conversation about pelvic health. So, why do these problems often go unaddressed?
For one, there's a lack of awareness about pelvic health and the potential risks involved.
Many people don't know what constitutes a healthy pelvic floor, let alone how to maintain it,
Additionally, there's a stigma surrounding pelvic health issues.
making it difficult for people to seek help or talk openly about their struggles.
Our lifestyle choices, for instance,
Can have a significant impact on our pelvic health. A sedentary job, poor diet, or lack of exercise can all contribute to a weakened pelvic floor or increased inflammation.
leading to a range of issues. Pregnancy and childbirth can also put immense pressure on the pelvic floor.
Leading to incontinence or prolapse.
As we age, our bodies undergo natural changes that can affect our pelvic health.
Such as menopause or prostate enlargement.
What is VVF?
Vesicovaginal fistula (VVF) is an abnormal connection between the bladder and the vagina, leading to continuous and involuntary leakage of urine into the vaginal canal.
Common causes of VVF include
1. Obstructed labor.
prolonged obstructed labor without timely medical intervention is the leading cause.
Especially in resource-limited settings.
Pressure from the baby's head against the vaginal and bladder.
2. Surgical complications.
Injuries during gynecological or obstetric surgeries, such as hysterectomy or caesarean section,
Can result in VVF if the bladder or vaginal wall is accidentally damaged. 3. Radiation therapy. Radiation treatment for pelvic cancers, for example, cervical or bladder cancer, may damage surrounding tissues,
causing fistula development over time,
4. Trauma. Physical trauma,
such as from sexual assault.
accidents, or pelvic fractures, can lead to fistula formation. 5. Infections.
Severe or untreated infections affecting the pelvic region can erode tissues, causing fistulas. 6. Malignancies. Advanced stage pelvic cancers, such as cervical or bladder cancer, can invade nearby tissues, leading to fistula formation. 7. Congenital abnormalities. Rarely.
Some women are born with anatomical defects that result in fistulas.
8. Prolonged use of obstetric instruments,
Incorrect or prolonged use of instruments.
like forceps during childbirth, can damage tissues.
9. Harmful cultural practices. Practices like early marriage and childbearing in physically immature girls increase the risk of obstructed labor and fistulas. Prevention strategies. Access to quality maternal health care. Early detection and management of obstructed labor. Skilled surgical care. Education on delaying early marriage and childbirth.
Proper use of radiation therapy and medical instruments
Effective prevention and timely surgical repair can greatly improve outcomes for individuals with VVF. So,
What's the main insight here?
it's that simple lifestyle changes,
Combined with seeking medical advice when needed, can significantly improve our pelvic health and reduce the risks of these common issues. By taking small steps, such as incorporating pelvic floor exercises into our daily routines, making healthy lifestyle choices, or speaking candidly with our healthcare providers,
we can take control of our pelvic health and transform our lives. When it comes to pelvic health, awareness is key.
By acknowledging the risks and taking proactive measures,
We can overcome the shame and stigma surrounding these issues. Remember, pelvic health is not just about sexual function or bladder control.
it's about living a life free from pain, discomfort, and embarrassment. Thanks for joining me on this journey into the world of pelvic health. If you've had experiences with pelvic health issues,
Please share your stories in the comments below.
what questions do you have about pelvic health? Let me know, and I'll do my best to answer them.
If you want to learn more about pelvic health topics, be sure to check out my next video.
Where I'll be diving deeper into the world of pelvic floor exercises.